Hi, Dr. Dan Purser, danpursermd.com. Tonight we're going to do a quick Facebook Live on estrogen, estradiol, and Clary Sage. To my left is Brecken, my lovely assistant and stepdaughter. Across from me is Jackson, who's still single. No one sent him cookies yet. Okay, let's...
I'm shaking my head.
He hates that. He hates that. Or build him a cake, please, like Napoleon Dynamite. Okay, we're just going to get right to it. You guys always say, why doesn't he get to the point? Why doesn't he get to the questions? So we're just going to do that. We're going to try this new format, see how it works. Okay, Brecken, you're on.
Yeah. What is estradiol?
Estradiol is a female hormone. The men make a little bit of it too, but it's what makes ladies a lady. It's what makes a woman a woman. It gives you your hips, gives you your fat pads, gives you your breasts, gives you your hair, your thickness, your beautiful soft skin. It makes you a woman. Helps you keep hard bones. There are literally hundreds of benefits of estradiol. I think I have a little book out, Estradiol, Estrogen, and Menopause, something like that.
Yeah, something like that.
Yeah, it was #1 for quite a while. Check that out. It's cheap on Kindle, or we'll make it cheap.
GreatMedEbooks.com.
GreatMedEbooks.com. Okay, next question.
What's the #1 reason you prescribe 17-beta estradiol?
Yeah, that's the estradiol. That's the bioidentical estradiol. The #1 reason I do is for menopause. And #2 would be osteoporosis.
What's your preference, cream patches or pills of estradiol?
It's according to where that patient is in their life, how far they've been since menopause, and we'll get to the tenure window here eventually, I think. But you want to have them inside the tenure window. I prefer the pills almost always, but if I can't, I'll go with a cream.
So someone my age shouldn't necessarily be taking estradiol, right?
You're what?
I'm
18?
24.
24. It's 24. No reason to.
Yeah. Okay. What about
Let me back up.
Yeah,
I've had
go ahead.
girls with ovarian insufficiency or early ovarian failure, early menopause at 21 or 23, but usually they're trying to find out why that is. So someone's giving them estradiol usually.
Interesting. What if your husband has high estradiol? What can he do about it?
He can go to some doctor who doesn't quite know what they're doing and get it lowered. I wouldn't do that. I get young BYU, University of Utah football players in my office. Their testosterone level is 1,400, 1,200, 1,300. And they have super high estradiol levels. I can't, I shouldn't, and I won't bring down their estradiol levels, even though they're beyond the 5% that most men like it to be. It's because it's cardioprotective for them. It's very helpful for men to have a little estradiol, and it converts off your testosterone into estradiol. I leave it alone. I've changed in the last year and a half, or last 2 years really, since Dr. Rouzier gave that famous speech in Tucson about why are we treating estradiol levels in men? And it was a great speech, really well researched, and I haven't forgotten it, and so I don't treat them.
Yeah. It's interesting for
He's
sure.
just trying to educate the men.
Yeah. Does estradiol cause breast cancer?
No.
Why is there a stigma around it causing it?
Breast cancer can come with no receptors, no hormone receptors, or estradiol receptor, progesterone receptor, or both. Or it can be triple negative, as they call it. Just the fact that there's a receptor on it doesn't mean the estradiol caused it. In the nurses' study in the Women's Health Initiative, when they gave women just straight estradiol with no progesterone, and they used the 17-beta estradiol in those studies, women had a 30% reduction in breast cancer and a big reduction in colon cancer. So there's just no evidence to support that, though doctors ignorantly and often conflate estradiol as causing breast cancer. It doesn't.
So crazy. Does estradiol cause clots?
In some women, if they're outside the tenure window, which we'll get to, I think eventually, if they have high blood pressure and they're postmenopausal. So if they're postmenopausal and outside the tenure window if they have high blood pressure and they're postmenopausal, or if they have factor V Leiden, they could get clots by taking oral estradiol.
Why should women be taking estradiol? I know you kind of talked about that right when we first started.
Wow.
But why?
100 reasons. It keeps your skin soft. It keeps you wrinkle-free. It keeps your hair thick and lustrous. It keeps it protects your blood vessels, your heart. It protects you from oral estradiol. Protects you from diabetes, strokes, heart attacks, the big three killer in women. And yeah, breast cancer is not in there if you noticed. It's not one of the big three killers in women. Man, my voice. Sorry.
You've been talking too much this week, huh?
Too much chatting.
Sorry. That's much better. It keeps your bones hard. It does so many incredible good things for women. And women go say, I had an easy menopause. I don't need to take any of that. So not true. It's incredibly anti-aging to take estradiol.
So important.
Very important.
Yeah. Like you said at the beginning, it's what makes women women, right?
Yeah.
Yeah. What can you do to lower your estradiol level if you have estrogen dominance?
I don't lower estradiol levels because women have estrogen dominance. Estrogen dominance occurs because they don't have enough progesterone in their system. It's not from too much estradiol. That's a common misconception. They need a lot more progesterone. I know I've had patients come to me saying, I'm 38. They want to remove one of my ovaries because I have estrogen dominance. And I'm just like, wow. No, you raise your progesterone level, and that ends the estrogen dominance issues. Whether you take it orally, sublingually, the progesterone, or you take a serum like we're all familiar with. There's lots of ways to get progesterone into your system. OBGYNs will even use injectable progesterone when women are pregnant.
Yeah. What is Premarin? Premarin?
Premarin is from pregnant mare's urine. It is indeed. That's where they got the name. It's both 17 beta estradiol and conjugated equine estrogens, or CEE, as they're called in all the research articles, which cause a really high risk of clots, strokes, and breast cancer. So you don't want to. I avoid CEs. I haven't prescribed Premarin probably in 25 years. It's still probably one of the most common prescribed postmenopausal hormones. They don't understand progesterone, but they'll prescribe Premarin, horse estrogen. Wow,
It's so gross.
it's kind of weird.
What?
But I was taught to do that in medical school and residency.
Yeah.
So
It's a normal thing. What kind of estrogens are in birth control pills?
none.
How come that's something else that's always believed?
Misconception, misnomer, misinformation. They could read the label and see what's in there. It's synthetic progestational agents that's in there. So why do they put the label in every bottle, every packet of pills? Not the label. Yeah, the label.
Like
No.
the warning label?
Yeah, the warning label.
So you can't sue them.
Right. That's right. Try and sue them for that clot, stroke, heart attack, or breast cancer you get, which is really, you get a 250% increased risk of breast cancer with birth control pills. If you're prior to age 18, you get a 500% lifetime risk of death from breast cancer if you take birth control pills, or give that 16-year-old or 15-year-old or 17-year-old girl birth control pills. That's death, 500% increased lifetime risk of death. That's from two big European studies that have been really squashed. They're in my book, The Breast Cancer Patient Survival Guide. If you want to look at the studies, they're both out of Northern Europe, Scandinavian countries. There is no estradiol in there, but there's a synthetic progestational agent. Usually norgestrel is what they use.
Yeah.
Like in the IUD, Marina.
Yeah. Does Progestins Plus have estrogen support in it?
No,
It's completely
just-
different.
which is progesterone support, yeah.
What-
I know, I've been asked that question a lot lately. I'm not sure where that came from. Clary Sage, sclerosins, and Lady Sclerol definitely have estrogen support in them. but not Persistence Plus.
Something different completely.
Yeah.
What's your favorite form of estradiol to prescribe?
Or oral estradiol 1 milligram. You can get generic estrace, cheap, 100 of them at Walmart or Costco. I think it's $8 or $12. It was before Obamacare. I don't know what it got jacked up to during Obamacare, but it's still cheap. And it's 17 beta estradiol, just like Mama makes.
Why are those your favorite?
Just cheap, and they work really well.
Nothing bad in them.
No, I just told you 30% reduction in breast cancer risk. I make sure the woman's within the tenure window, and I make sure she doesn't have high blood pressure, and I make sure, if possible, that no one else in her family ever had a stroke or clot on estradiol, or we check her genetics and see if she has factor V Leiden.
Yeah. What is the tenure window? You've mentioned that a couple times.
Yeah, sorry. Tenure window is a concept that's really not well understood by the medical profession at large. And I've explained it a couple of times in some of my books, like my book on estrogens and estradiol. The tenure window states that if you're postmenopausal, for whatever reason, whether it be surgical, traumatic, or natural, and you go 10 years without receiving oral estradiol, you should never be given oral estradiol from that point forward, because it causes a problem with metalloproteinases in the blood vessels, and you can break loose chunks of plaque and get a stroke or a heart attack. But if you're before the tenure window, and you, let's say after 3 years, you put on Premarin, which does have 17-beta estradiol in it, or you put on Estrase or some other 17-beta estradiol, then the clock resets. Let's say you do that for a year, then you have another 10 years to go on it. So I always grill a new menopause patient, say, you were given Premarin. When was that? Do you know the years? And they'll say, yeah, it was in 06 to 2013. I'll go, okay, so you haven't taken it in 7 years now. Okay, but we're still okay. You're still within the 10-year window. The other thing that we know is that women with high blood pressure who are postmenopausal shouldn't be given oral estradiol.
How come?
It does the same thing. It causes clots or strokes. Mm-hmm. So, but remember, oral estradiol is much more beneficial to women than creams or patches.
Yeah, just more effective.
Yeah, well, the big three, it knocks out the big three causes of death in women: heart attack, strokes, and diabetes. So,
yeah. You mentioned factor V Leiden. What is that?
it's a genetic disorder, and I do test for it in our Pro 7, looking for clotting risk, stuff like that. And if you have factor V Leiden, either one or two of the errors, if you're homozygous for it, definitely. But if you're heterozygous, I still not take oral estradiol. But doctors have done a blanket statement on that. It's like they do with breast cancer. You just can't take any hormones. But with breast cancer, progesterone is really beneficial to take with almost all forms of, to my knowledge, all forms of breast cancer.
Yeah.
That's what I was taught at USC.
What about like the Biotech estradiol pellets? What do you think about those?
They're good. I don't think they're as good as taking oral estradiol. We use Biotech also, but we never use the estrogen in the pellets.
Yeah.
It's much more beneficial for women to take it orally because the estradiol goes through your liver, and that's where the benefits come from in preventing the heart attack, strokes, and diabetes.
Gotcha. That's interesting. So what about people who have liver problems? Do they have a harder time with estrogen and making it? Sorry, that's my own weird question.
I don't know.
Yeah.
It varies.
I'll do some research on that. That's interesting. What is Clary sage and why should you care?
Clary sage is one of my favorite essential oils. It's not my favorite. You guys know what that is. But it's one of my favorites. I had looked at about 400 lab levels on women I'd drawn at convention one year, and in none of these women, they're all menopause. None of them should have had normal estradiol levels, and they did. And so I asked Gary, none were taking estradiol. I listed their medications and everything. I asked Gary Young, what were they taking that gave them a normal estradiol level? He said it's Clary Sage. I was like, wow. So I asked all those women, indeed they were all on Clary Sage or Estro, or which isn't available anymore, or sclerol, sclerescence or lady sclerol, which are all the forms of Clary Sage that Living has sold,
Yeah.
and they gave them normal estradiol levels.
It's amazing.
I don't know if but the next issue I had was I don't know if the lab equipment was fooled by the Clary Sage into thinking. Sorry, it was estradiol or it was just estradiol. Sorry about that water trying to come up. Ugh.
It looked great on camera. So.
Everyone enjoy that part.
Yeah, they're all laughing at me and throwing stuff at the camera. I mean, at the screen. Okay, so yeah, but whatever it is, it gives women estradiol-like benefits. A lot of them, and a lot of women prefer, especially among living distributors and doTERRA distributors and more natural women want Clary Sage. So I guide them on how to do that. 8 drops in the morning. That's how I do it. You can take it orally or topically.
So not at night. You want to take it in the morning?
No, sorry. Yeah, no.
Okay.
And
Interesting.
Progestins Plus only at night.
And where do you apply it?
To your ovary Vitaflex point inside your ankle,
Gotcha.
usually. Clary Sage smells pretty strong.
Mm.
Wear about 4 pairs of socks, but put it in there first, and then, yeah, you got it.
Some people like the smell.
I know. Fluorescent smells good.
Mm-hmm. What are the
But
other...
hang on. When I asked Gary, well, which one should I tell him to use, the Clary Sage or Fluorescence or Lady Sclerol? He said, just tell him to use Clary Sage. It's a little cheaper. It's the money product. It's the one that really increases and duplicates estradiol, all that. And so that's what I do. Clary Sage.
Yeah. So those other forms of Clary Sage are like the sclerol and all those, but
Yeah,
you prefer...
It's clearly the sclereol in we know that from research in the Clary Sage that gives you the benefits. So I think sclerol and sclerescence is just a way to focus the benefits of the Clary Sage, but I don't know that.
Yeah.
For sure.
Does Clary Sage support or replace or increase estradiol?
I don't know that. I've never been able to figure that out.
Yeah. Just interesting.
Good question, though. I've looked in the literature. I've done tons of research. I don't know, but it sure mimics it.
Yeah. And definitely women feel better on it. So.
Yeah, they
Right.
like it and they like what makes them so. Also, lots of studies out of Iran and Europe showed a 30% decrease in breast cancer risk, but so does estradiol when women use Clary Sage.
Mm.
But women, so I mostly suggest it very strongly in women who've had breast cancer but want something that doesn't have estradiol so they can use it and not make their oncologist mad at them.
Gotcha. Kind of a little workaround.
Yeah.
Is there any other time that you suggest it?
When they want supernatural options, don't want to use hormones.
Gotcha. Does taking estradiol or does estrogen cause weight gain?
It can if it's unopposed with progesterone and testosterone.
So you always have to make sure everything's balanced and...
Always. You need
Yeah.
a good hand on that. That's my job, to educate you how that feels, what that does, what that looks like. Okay.
Yeah.
Let's roll through the rest of these.
Yeah.
We're past our time limit.
We're getting...
Jackson's going to shut us off.
Got my finger on the close
Oh
button.
no, stop.
Is there a link between estradiol and anxiety?
Yeah, low estradiol levels in menopause can cause some increase in anxiety. It's more associated with low progesterone levels though, but either one of those can cause anxiety.
Yeah. Does lack of estradiol cause hot flashes?
Yes, but it's not the most common cause. 95% of hot flashes are caused by progesterone, 2.5% roughly are caused by lack of estradiol, 1% by lack of testosterone. DHEA, pregnenolone, and some others are the cause of the other percentage. Sometimes I can't find out what causes them. I get them on every hormone. They're still having them.
Yeah.
But that's rare. I think I've had 2 cases in 20 years.
Crazy. What can you do after the 10-year window? Just kind of...
Oh, you take cream or patch or Clary Sage.
Yeah. So that's the ones who can take it. Gotcha. This lady, she's 45 years old. She's been dealing with perimenopause symptoms for the past 45 years. Low libido, lack of concentration, fatigue, poor memory, muscle loss, hair loss, and now weight gain. But her PCP, primary care physician, refuses to run labs on her. Apparently all those symptoms are just normal, and she needs to just deal with it, get through it. What can she do?
Well, menopause is normal if you want to go there. But like when I heard Suzanne Summers when she turned 70, she says, I don't want to go like my mom. I don't want to go through that struggle, have breast cancer, heart attack, strokes like she did. Even though she had breast cancer at that point, Suzanne Summers said, I want to keep living young. I want to keep doing all these hormones. I love how I feel. I love how I can live. I love being able to work out. I love my life. So you can choose to go that road. That's natural. It's an option. Or you can choose to not go quietly into the dark, to fight every step of the way. We were at that movie last time.
Interstellar, yeah.
Yeah, sorry. Not quite in that form. Yeah, but you don't want to, but most people, most Americans, most people in the world don't want to go quietly into the dark. Just curl up in a ball
No.
and die in a few years. They want to live longer,
Yeah.
not have the problems their parents had. So, but at 44, that's not typical, by the way. Unless your mom went through menopause at 44 and you have a sister who went through menopause around that age. Sounds like more like you have ovarian insufficiency. 51, 52 is the age most women go through menopause here in the U.S. I would look at getting a SpectraCell. I'd call my office. We'll put the number up there, but I'd get a SpectraCell. Micronutrient panel and look inside your cells, see what vitamin deficiencies you have. There lies your problem.
Yeah, because a lot of those symptoms are more than just menopausal.
Yeah, hair loss and all that. I'd be looking at
The
vitamin
concentration.
deficiencies. Yeah.
Does estradiol help with decreasing cholesterol levels?
Yes, a little. And it cools arteries off. Yeah, protects your heart. Remember back to oral estradiol prevents heart attacks, strokes, breast cancer, or heart attack, strokes, and what was the other thing? I can't remember now. Heart attack, strokes, and diabetes. So yeah, it cools arteries off.
That's so cool.
So yeah.
What symptoms should you be looking out for to know that you might be low in like estradiol or progesterone?
Hang on, I looked that up a minute ago. Teasing. In one of my books. Bloating, if you're high in estradiol, swelling, tenderness in your breast, fibrocystic lumps in your breast, dense breast tissue, decreased sex drive, irregular menstrual periods that are crazy or non-existent, mood swings, headaches, anxiety, or panic attacks, hair loss. Well, we're describing that lady, cold hands or feet, that's usually thyroid, trouble sleeping, sleepiness or fatigue, memory problems.
Yeah. Basically everything a woman struggles with, huh?
No, it's from Healthline, yeah.
Because everyone needs help.
Right.
What tests do you usually recommend for getting hormones checked, like specifically for estradiol, for accurate numbers?
Estradiol level.
Just straight estradiol.
17 beta, yeah, estradiol level. I usually like to see it above 50 in women at any age.
Yeah.
Birth control pills, though, they'll be really low or non-existent estradiol levels. What test do I like? Personally, if you're my patient, I send you to Direct Labs on danperchermd.com. Go to the testing section and look at the link for Direct Labs. They have 1,300 draw sites nationwide, super cheap and expensive. You can order whatever you want on there. You can get a female panel, I think they call it, and it'll show estradiol, it'll show progesterone, free and total testosterone, maybe even a TSH,
Yeah.
FT3 and FT4, a DHEA, SO4. That's what it's kind of stuff I like to look at to determine if you're headed into menopause or not. One more question.
Well, last question that I just got was basically, where do we start with estradiol? How do we first get started in figuring out how to get it back on track? Would you say
Either
that?
get your doctor to check estradiol level according to your age. That's a complex question because if you're so young and you shouldn't be in menopause or shouldn't be dropping your estradiol level, you got to find out why.
Yeah.
And so someone needs to do root cause medicine with you. That's what I do. If you can't find a doctor who will, you can certainly call us and set up an appointment. We'll help you figure it out.
Yeah. And by the way, guys, this month we have decided to make
Two specials.
Yeah, we have two specials. We have our initial consult with Dr. Purser is actually $50 off.
Whoa.
I know. It's $200, which is our normal
I
price
can't
of a
send my kids to
follow-up.
college. Help.
Just you sent one just
Draft.
on the road yesterday.
Medical
2 days ago.
school. We go, yeah.
So
let's not talk about
take
that.
advantage of that special because we don't do that often. We don't drop initial pricing. So $200 for an initial with Dr. Purser. It's half an hour. Through the end, if you book it through the end of July, we'll offer that. And then the other thing is Copper Balance. You can get 15% off of it because we know so many of you were missing it so bad, and it's back now. We're offering 15% off of it with the coupon code July15.
It's one word, or
Yeah, one word, July 15.
and then what does that mean?
It's just a coupon code. It means you get 15% off.
Okay, or it could be that it's only good on July 15th.
No, don't confuse them.
Okay, sorry, I didn't mean to say that.
But
Okay,
yeah,
you know what? Thank you for listening. We'll try and answer your other questions and help you all with this. We're not going to do one next weekend because Brecken's going to be gone.
I am.
But 2 weeks, are you going to be back 2 weeks?
Yeah, I'll be back.
We'll do one on testosterone in women.
Yee.
Yeah, that's always exciting. And I'll show you what we do with testosterone in women in 2 weeks. Well, thank you.
Yeah.
Oh, I'm getting all kinds of bubbly things.
He loves all the pop-ups.
What does that mean?
They love you.
He loves seeing your love.
Yes.
I love you guys. Anyway, God bless. Go in good health. This is Dr. Dan Purser at danpursermd.com. Ciao.